You sit down for the OET speaking subtest. The interlocutor hands you the roleplay card and says, "You have 3 minutes to prepare." What do? If you are like 90% of candidates, you read the card from top to bottom, silently translating words and passively trying to memorize the bullet points. That is a guaranteed way to fail. In my last video, we broke down the hidden C1 to C5 clinical communication scorecard. Today, I am going to show you exactly how to map that scorecard directly onto your roleplay card during those crucial 3 minutes. Your 3 minutes of prep time are not for reading, they are for tactical mapping. If you don't know where the examiner's traps are hidden on the page before you open your mouth, your consultation will collapse. I am going to break down exactly what you must do in minute 1, minute 2, and minute 3 of your prep time, so you never leak points again. Let's map the card. Minute 1 is dedicated exclusively to the background information and the first 2 bullet points. When you look at the background setting, cross out any information the card says you already know. If the card says you are speaking to the mother of a 5-year-old, draw a line through it. Do not ask, "Are you the mother?" This prevents the identity drift mistake we talked about in the last video and instantly secures your C1 relationship building marks. Next, scan the text for emotional keywords. Look for words like anxious, resistant, confused, or demanding. When you see an emotional keyword, circle it twice. This is your C2 anchor. This tells you exactly what hidden fear you need to elicit in the first 60 seconds of the roleplay. Write the letters ICE, ideas, concerns, expectations, right next to this bullet point. This visual trigger will force you to ask, "Is there anything specific worrying you today?" before you dive into medical questions. Minute 2 is about securing your C3 marks, providing structure. Look at the middle of your roleplay card. There is always a transition point where you stop gathering information and start giving a diagnosis or management plan. I want you to physically draw a massive horizontal line completely across the middle of the card where this shift happens. This line is your visual barrier. You cannot cross this line during the exam without deploying a structural bridge. When your eyes hit this line during the roleplay, it is your cue to say, "Now that we've discussed your symptoms, I would like to explain your treatment options. Is that all right with you?" If you don't draw this line during your prep time, you will inevitably smash through the pivot, blindside the patient, and lose your C3 signposting marks. Your final 60 seconds of prep time are for the bottom of the card. This is where your C5 information giving marks are won or lost. The bottom bullet points are usually dense. They ask you to explain a diagnosis, prescribe medication, suggest lifestyle changes, and arrange a follow-up. If you leave these as one big block of text, the 90-second panic will set in, and you will trigger the dictator reflex. You will dump all of this information onto the patient without breathing. Take your pen and draw physical boxes around each separate management step. Box 1, diagnosis. Box 2, medication. Box 3, lifestyle. These boxes force you to use the 3-chunk rule. You deliver the contents of box 1, and then you must stop. You check understanding. Does that make sense so far? You do not proceed to box 2 until the patient gives you verbal consent. Pre-chunking the card guarantees your pacing remains controlled under pressure. 3 minutes. Active mapping, not passive reading. If you can extract the ICE, draw your structural pivot, and box your management chunks before the timer goes off, your clinical framework will be bulletproof. But knowing how to map the card and actually executing it under the intense pressure of the OET exam are two very different things. Are you still passively reading your roleplay cards? Are you routinely missing the structural pivot and causing patient resistance? Before you sit for your exam, you must identify where your specific vulnerabilities lie. I have built a free 60-second diagnostic tool called the Timeline Integrity Audit. Click the link in the description right now. Check the boxes that match your current practice habits, and the matrix will instantly calculate your exact risk of test day structural collapse. Stop treating the prep time like a reading exercise. Click the link below, take the audit, and start mapping your way to a grade B+.